Again, alcohol is very important contributing causative factor. Alcohol is a hepatotoxic. Alcohol is hepatotoxic. As I said, this acini, the hepatic acini is a functional unit. It gets supplied from both the sides of the artery, and the alcohol is a hepatocellular toxic substance taken in a more than moderate quantities. If you take more in moderate quantities, it may not cause any problem, but people who drink continuously, chronically in large quantities, they are more prone from developing a alcoholic liver disease is again a big topic. It can cause so many diseases in the liver, including obstruction, including hepatocellular carcinoma, including fatty liver. Fatty liver is another entity. So these are the general liver-related diseases. And treatment-wise, most of the causes. One is the fecal-oral route. Food can transmit the hepatitis, and sexual contact. People who are having habit of multiple partners or more prone. Drug abusers, IV drug abusers, and people who have taken history of uh, blood transfusion and blood products transfusion and vertical transmission. Okay.
Yes, sir.
Vertical transmission. Vertical transmission is mother to the baby. Vertical transmission, especially hepatitis B, is notorious to cause vertical transmission. So all viral hepatitis, be it A or B or C or D or E, clinically they all look same. You will not be able to differentiate unless you do the serological test. You will not be able to do. And there are now vaccines for hepatitis B. You have to take vaccine. All of us have to take vaccines, and we should be extremely careful. And you diagnose the hepatitis by doing blood parameters. Liver function test is a very good, handy, small, cheap, time-tested parameter. These parameters, the biochemical parameters of liver function, like bilirubin, like your transaminases, GGT, serum albumin, prothrombin time. These are the and haptoglobins. These are the biochemical parameters with which you can differentiate what kind of disease we are talking. Prothrombin time. Prothrombin time is again an indicator of your coagulation defect, which is a part of the liver function. So these are the investigations. And you do ultrasound of the abdomen. Ultrasound abdomen will not only tell you the size, but also many times will show you the what kind of disease. Is it a hepatobiliary system or only liver-related diseases? You can also see if sometimes there is a cyst, there is an amoebic liver abscess or a hydrated cyst in the liver or hepatocellular carcinoma. Sometimes there is a small lesion you may miss, so you have to go for a CT scan of the liver. So ultimately, if you really want to know what kind of liver disease is ultimately, last resort, you can do a liver biopsy. Liver biopsy will tell you what is the histopathological disease that the liver is harboring. So these are the various stages of usually many viral infection, hepatitis are self-limiting. There is no need of treatment, but the unqualified doctors, there's so many unqualified doctors are there. They give treatment for the jaundice treatment, which is very popular in all the cities and district villages of our country because it is self-limiting disease. 70% of the viral hepatitis are they're self-limiting. After 1 to 2 weeks, they become all right. And these fake doctors claim that their medicine is working, and people go in a big queue and paying a lot of money. So that is very common in our country. So don't take because the drug-induced hepatitis, toxins-induced hepatitis also is very common. Especially anti-tubercular drugs are notoriously known for drug-induced hepatitis. So we should be very careful in. Sometimes some antibiotics also can cause liver damage. So we should be very careful. Especially anti-tubercular drugs are common to cause drug-induced hepatitis. Traumas, of course, are very less. And as I told you, other systemic diseases, when your liver is not functioning, when LFT is abnormal, you can always not necessary to blame the liver. You also look for the other features. suppose a patient is in heart failure, congestive heart failure, because of the back pressure, patient may have congestive heart failure. The liver may become enlarged, congested, and your LFT may get deranged. So that doesn't mean always that there is a liver problem. You treat the heart problem, heart failure, by giving diuretics. Next day or after 2 days, the liver congestion comes down and your liver parameters may come down to normal levels. So that is one important aspect of systemic diseases causing the effect on the liver. So history is very important. History of travel, history of any drugs, history of any drug abusers, history of sex, multiple sex, history of alcohol, history of any toxin, exposure to toxin, blood transfusions, recent delivery, recent infection, recent surgeries. These are all the history points that you have to take sitting next to the patient. You have to go into the depth of the history and then examine, like what I said, top to bottom, because there are peripheral signs of liver failure, as we discussed, like hair on the chest, testicular atrophy, palmar erythema, spider nevus, ascites, jaundice. All these things you have to carefully look for. So a detailed history and examination will many times give you the most likely diagnosis. Most likely diagnosis. Of course, you have to take the help of the investigative tools that you have handy with you. So I think we will close for today. If you have any quick 1 or 2 questions, we will take it.
So for jaundice, people take jadi booty. How?
Yeah. So that's what I said. See, jaundice is most of the times self-limiting. Even those people who treat with country medicines, sometimes they go into complication. They'll say that no, go to some big doctor. They will say, but because it is self-limiting, no medicines will no. There is no antiviral treatment. Yeah.
This doubts.
Who said? Hepatotoxic drugs also. A and E are fecal-oral and rest are body fluids. Yes. Sir, can you explain the relation between estrogen metabolism and liver disease? Oh, this I have to read. I don't know the metabolism. You have to read the biochemistry. Irkhan ki pudi. Wow. What kind of drug is it? Where is it available? Irkhan ki pudi. Yeah, they tell you to put drops in the eyes. I don't know. Can you hear me?
Yes, sir.
They also give some eye drops to treat the jaundice. So these are all funny people are there around.
Someone is asking, do we have to restrict meat intake during jaundice?
Yeah, that's a big controversial question. Food restriction. Some people say don't eat this, don't eat that. Some people say rice mat khao. Some people. So avoid fatty food, which is not strictly necessary these days. In olden days, we used to say that there should be strong diet restriction. You should not give oil and other things. But today, it is established beyond any doubt that there is no need of very strict diet restriction in terms of oily food and fatty food. You can still take little, but don't overeat those oily and fatty substances.
What is the significance of ALC value in LFT?
Alkaline phosphatase, yeah, that's another very important blood test. Alkaline phosphate usually, see, as I told you, the diseases of liver are divided into inflammatory and obstructive. Number A, inflammatory, like your viral hepatitis. Number 2, obstructive, like your obstructive jaundice, a stone or something. Number 3, mixed. Many diseases are mixed. They have both inflammatory and obstructive type. So, what is the question?
Significance of ALP.
ALP, alkaline phosphatase, is elevated in an obstructive type of liver diseases. Usually, if it is exceeding 3, 4, 5-fold, you think in terms of some obstructive pathology going, whether it is intrahepatic or extrahepatic.
So, what's the significance of GGT?
GGT, again, GGT is a non-specific test. Any infection, any liver disease, the GGT can be elevated, including your alcoholic hepatitis. Even somebody is just alcoholic, no hepatitis, GGT can be elevated. GGT is totally a non-specific test, but very high values may even suggest cirrhosis or even hepatocellular carcinoma. So GGT alone cannot be taken as a parameter to diagnose any disease. So you have to take everything into consideration before concluding the levels of, before the GGT levels. Again, it is non-specific.
What's the mechanism behind asterixis?
Asterixis, exact mechanism is this: patient is not able to hold the wrist joint extended for a long time. That is because of your hepatic encephalopathy, where your ammonia levels, the ammonia levels are high. In hepatic encephalopathy, what is the cause of hepatic encephalopathy? The ammonia that is circulating in the blood is more, which is going to the brain, crossing the blood-brain barrier. The elevated ammonia levels will not allow you to keep with your wrist extended for a long time. Exact biochemical cellular mechanism, I don't know.
What is the treatment of fatty liver and how to prevent it from transforming to hepatitis?
Yeah, that's another very intelligent question. Fatty liver, till last 10 years, we used to think that it's just a routine observation, especially seen in people who are obese. But of late, many researchers have found out that fatty liver is not as simple as we are thinking. There's a lot of fat deposition in the liver, especially seen in obese people. So these fatty liver patients also can develop in future some chronic liver diseases like cirrhosis and hepatocellular carcinoma also. And fatty liver has to be treated with weight reduction, and there's some specific drugs nowadays. I don't know how far they are useful. I have not used any, but weight reduction, walking, daily walking, and a low-fat diet will reduce the fatty liver to some extent. But few people of fatty liver can develop future carcinoma and cirrhosis. So it's not as simple, but many times it may be by benign, incidentally found condition.
GGT greater than 300, is it a problem, sir?
No, that's right. GGT alone, even if it is 300 or 400, 500, GGT alone cannot be taken as a significant diagnostic point. You have to correlate with other things. Thank you very much for your heat. So I don't know, a couple of questions I was not aware. I'm sorry. I'm still learning. I'm like a student. I'm still learning. I don't know. I know only 1% of medicine. I don't know 99%. So sorry. Whatever little I know, I told. If I am not able to answer, sorry. You can check the books and the micro details. We are clinicians. We are physicians. Biochemical changes are very difficult to remember. Anyway, thank you very much once again.